All right, poll time. For those of you who are able to join us today, I don't know where you are, but where I am, it's a beautiful, beautiful day. It's super sunny outside. It is nice and has been rainy and drizzly for the last week. So I really appreciate you all taking the time to come and join us today. So poll questions. I'm going to do a couple quick polls. Where are you from is the first question. Where are you from? I get excited with these polls. All right, I'm going to close the poll because we have about 80% voted now. I'll close the poll and share the results. And so we have about 48% from the US, Eastern US, 14% from Middle US, 24% from the Western part of the United States, and we have 14% from outside of the United States, which is fantastic. That's great. That's probably the highest percentage that we have ever had. So that is great. Welcome. Thank you for joining us. And then I want to ask this question. I'm going to launch the poll. Is your clinic open? If you run a clinic, you don't answer if you don't have a clinic, but if you run a clinic, is your clinic open? Yes, yes, but only for emergencies, or no, we are totally closed. Here. So is your clinic open? 20% say yes, 30% say yes, but only for emergencies. And then 50% say no, we are totally closed. Let's do one more. When do you plan to open? Limited or not limited? May 1st, so we'll call that May 2nd. May 15th, June 1st, June 15th, or still unsure? Here's the, so 5% say May 1st, which was yesterday, so congratulations. May 15th is about 35%. 20% say June 1st, 5% say June 15th, and then 35% are still unsure as to when this is really going to happen. So, so anyway, great information. I appreciate that. Thank you so much for sharing in those polls. That's very helpful for the folks that are speaking today. Give them some background information. A couple of quick announcements before I introduce Jamie. Just to let you know, this is being recorded. This will be posted up on the YouTube channel. It's the Community Cats Podcast YouTube channel. If you're not a subscriber to that channel, please go to Community Cats Podcast. Just search for it in YouTube, and you can hit the subscribe button so you'll always know when a show or a presentation like this comes up. And also, I just wanted to give you an announcement sharing that after May 11th, which is going to be a week from this coming Monday, I'm going to be pausing the pop-up panels. So we're going to do 2 this weekend. We'll do 2 next weekend, meaning the Saturday-Monday combination. And then after that, we're going to do a little bit of pause because I have a feeling many people are going to be working very hard to get their clinics up and running at that point in time, as well as out trapping and assisting cats. So we'll do a little bit of a pause. If it seems like there's a need to bring the pop-up panels back, we will. But I'll be working hard to get the online kitten conference up and running, or not up and running, but continuing to work with it and build it up. Our online kitten conference is going to be June 12th through the 14th. We have an incredible lineup of speakers for that. And so we'll be focusing on that. So there's going to be about 4 more, well, including today, will be 4 panels. And so make the most of them. And I hope you've enjoyed them and really appreciated them during this time. I've appreciated them, and I want to thank again the panelists who've taken their time to present to this group and share, and I hope everybody has found them valuable and important. All right, Jamie Case is with Gateway Pet Guardians, and she is here to share with us her experiences and how she's been handling COVID-19 and sort of the past, present, and future. So Jamie, thank you so much.
Thank you so much for asking me to be on this. I love telling our story and getting our story really out there to others. So a little bit of background information on who we are and who I am. I'm the executive director of Gateway Pet Guardians. Our organization is located just east of the Mississippi River, across from St. Louis, Missouri, in East St. Louis, Illinois. That is the service area that our organization is focused on. So East St. Louis, Allerton, Centerville, Washington Park, Cahokia, and Fairmont City, all communities that almost half of the population lives at or below the poverty line. And resource desert. There's no vet clinic. There's no pet store. Very few grocery stores for human pet food. No less quality, or human food, no less quality pet food. So we have been working in the community since 2004 is really when we incorporated, but I came on board in 2008 and realized we were never going to intake our way out of the problems that existed. That service area is about 65,000 residents, and 25% of the animals that went into our county municipal shelter came from those communities. And only about 23% were leaving alive in 2011. And that was a really big problem. At that time, we were dealing with mostly large dogs and puppies because that was just the climate. Again, no resources whatsoever. So spay neuter was never anything that really was considered at all at that point. So we started spay neuter efforts in 2012 after really seeing those dismal numbers from our community. So we started spay neuter 2012, and we started transporting to our high volume clinic that had just opened on the Missouri side of the river at that time. So we started slowly. We were a small foster-based only organization with no shelter. So we would be able to handle a large amount of puppies. And that was a lot of what we found. We also had a very high feral dog problem because of the number of abandoned houses. Puppies mama dogs would have their puppies inside abandoned homes. Those puppies would then grow up on the streets without any human interaction. That led to a very large, almost wild dog situation all throughout the community, which also kept the cat population low. We really didn't we had pockets of community cats, but not very many. So community spay neuter, owned pet spay neuter drastically helped the intake problems that we were seeing in our municipal shelter, and the packs of dogs on the streets. As community owned pets were being fixed, there were less puppies being born in houses. So we continued with that work and started to see the numbers go down, and the dog numbers go down. And we started then in around 2015 to see the community cat numbers start increasing. So we then instituted TNR efforts. Our goal and our mission has really been to target that community, but we did do some work outside of the community as far as intaking animals from St. Louis across the river, but it always kind of clouded our mission. We then started working with families and arose the need for general vet care, vaccinations, heartworm preventative, heartworm treatment, minor wound care, minor vet care, emergency services, and things like pet food needs, and just a really a lot of needs, because there was literally nothing in the community. So I would say maybe it was 2018, we really came together. We had gone to one of our donors and asked them to support our community work, because we were doing so much to help families in the community, and we asked for a sponsorship of a salary. So we got our first community director in 2018. During that time, we really decided that we wanted to put our stake in the ground and say, this is our service area. We want to see the needle move on numbers in our community. So all of our services, any resources that we have, are going to be dedicated to those 6 zip codes and those 6 municipalities that we work with. So we did that, and we've been wildly successful. In 2019, we closed on a 54,000 square foot former elementary school that we have been renovating since early spring of 19. We were slated to open that facility to the public on March 26th, when really the whole COVID-19 happened. We ended up kind of closing our doors for the most part to the public that week before, which was devastating to all of us. Within that 54,000 square feet, we housed adopted adoptable dogs. We had an adoptable cat space. And then we also had a public clinic that we had 3 exam rooms, a waiting room, and then a surgery suite on the other side of the building to be able to do in-house surgeries and TNRs. We have been working with our high volume clinic across the river to do our TNR surgeries, but it's a lot of work, and to have it right in the community that we're servicing would be is a lot more convenient and less expensive. So all that has kind of halted. We are in the midst right now of figuring out when we can open those services back up. Our give day is next week, where we're raising the remainder of what money we need to outfit that surgery suite, so that hopefully in July 1st, we'll be able to hit the ground running, because there was already a backlog of appointments and things at our high volume clinic, because of vet shortages, vet techs, all of those things. So we were really, really anxious to start doing and moving things in house, and I'm hoping July 1st we'll be able to really start surgeries, kick our our TNR efforts back into play, and then work on our intake backlog that we have right now for adoptable pets. So we know we have a lot of work to do, but what I feel confident during this time in knowing is that we tackled a very large overpopulation, street level problem within 3 years, that had existed since the existence of the community. And again, with spay neuter, and not even, it was targeted spay neuter and it was regular spay neuter, but it was not an overwhelming amount, and we were able to tackle that problem in 3 years and completely wipe out the stray wandering dog problem. I feel confident that once we hit the ground running in July, that more and more animals are spayed and neutered than were ever before, because we've continued those efforts. And I feel confident we're going to be able to bounce back, no problem. And then hopefully be able to help others that are dealing with, a backlog of surgery needs at that point in time as well. I think that was my 10 minutes, but I don't know.
Jamie, thank you so much. Appreciate that. And thank you for sharing. Before I actually, since this is my panel, I get to ask questions ahead of time. Can you just share a little bit about your house potty thing that you did? I thought that was very innovative. So just trying to think we all worry about fundraising down the road. And so just share a little bit about that idea.
Sure. So I sit on the task force of the St. Louis Pet Lover Coalition, which is a group of about 40 organizations in the St. Louis metro area. And we have been doing some collaborative fundraising over the past few years. We had an event in 2017 for the first time called the Shelter Slumber Potty. And that event was in response to a large influx of parvo cases that we had, and we needed money. And our program director at the time said, I'm going to spend the night in the kennel, raise money, hopefully get my favorite dog adopted in the meantime. And so we took that one step further and put 13 people in our 13 kennels and asked them to spend 24 hours there and raise money the month before, for this really fun event that we had. And then we live streamed the whole thing on Facebook for 24 hours. The second year, we had a partner organization, the Belleville Area Humane Society, join us, which was really fun. The first year, we raised $30,000 during that event. The second year, as a group of the 2 organizations, we raised $50,000. And then last year, we asked the entire coalition, and 15 organizations participated, and we raised almost $300,000 in that Shelter Slumber Party. So as I'm sitting and I'm watching all of this amazing movement happen in shelters all across the country of just emptying into fosters, and we ourselves put out a press release and got over 350 foster applications in the month of March, which is 5 times more than we've ever gotten before. It was apparent that we needed to do something fun at home. I also have 2 small children, so we watch everything online that we can for entertainment. And so this was a fun way that we thought we could pull everybody together. And so we opened it up nationally, and we had 94 organizations participate. And we had a variety of some celebrities, some music, some games, just a night where we could all get together as animal welfare organizations and celebrate the fact that some really great work was happening. And I know that, stalling spay neuter is the negative of this in our world, but some really, really great stuff it is happening in our industry, and we needed to celebrate it.
Thank you. Thank you for sharing. I thought it was a great idea and something new, different, and unique that was good at this time of uncertainty and, wondering, well, who's going to want to donate to us right now and all that kind of stuff. So thank you for sharing that. All right.
Okay,
There
hi.
you are. Excellent. Excellent. So this is Dr. Kimberly Carter at the Oklahoma State University. The floor is yours.
Okay, thank you. Yes, College of Veterinary Medicine, and just a slight political disclaimer, opinions expressed are all my own and not necessarily reflect those of Oklahoma State University. So we got that out of the way. So yes, for our community cat program here at Oklahoma State University, I'll just give you a little background. So we started a community cat program free to the public, sponsored by donations. Petco has been one of our big sponsors, and we once a month for 7 months during the academic year do TNR for the community, for community cats, free of charge. And unfortunately, most of our workforce is student-based, so we had to shut down our clinics. So our March and our April clinics, which are obviously our big clinics, we get all the pregnant girls in March. We had to quit those. Spring break came around and our students were sent home for spring break, and then they were supposed to quarantine and not come back for 2 weeks. And then during those 2 weeks, we got the announcement that, nope, school's done for the end of the year. So that ended up canceling both of our big spring TNR clinics, because we have approximately about 100 volunteers ranging from all 4 years of our vet students, from first years to fourth years. Our fourth year veterinary students are our surgeons, so they get experience in the TNR process, and we expose them just to all the concepts of the TNR programs. And then we also have undergraduates, so the pre-vet students, and then we also have community volunteers. So both of our animal welfare organizations here in the city participate. So that was a big hit for our program, and we will start back up in September, hopefully. Fingers crossed that school will start again in August. Vet school is now, like most of all the other colleges, by distance learning. Now, the exception to that is our shelter program, because you can't teach surgery unless you're doing surgery. You can't learn it. So we convinced our academic dean, and so we made a lot of changes on the fly for the past month, but we were able to keep our shelter partners serviced at a trickle. I will say a trickle. We've got to cut our caseload in half. So we're abiding by the CDC recommendations of keeping less than 10 people in a room at a time. We all wear PPE at all times, and we changed our check-in process to paperless, so everything is electronic. And then before, we also changed how we intake the animals. We set up a gated area. They come into the gated area. You take off your leash, we put on ours, and then we walk the dogs in. And then for carrier animals, they'll set all the carriers, unload all the carriers. The transporter leaves the area. Then we'll go out, wipe down all the carriers, and then take them in. So it was really a lot of changes in a short amount of period. But the advantage is that we were able to keep servicing our shelter partners with some surgeries. Now, I will say our COVID situation here in Oklahoma has not been as hard as most of all y'all folks on the East Coast. I just looked at our stats before I came on air here, and statewide we've had 3,800 cases, and here in Payne County, where we are in Stillwater, Oklahoma, there's 44 cases with 1 death. So I will say that our human side has not been affected as bad as you guys on the East Coast, and our healthcare system has not found has been able to handle the caseload and not felt the strain that you guys have. Our PPE situation, like I said, we felt safe on continuing and holding our surgery days because we use, most of everything is cloth. The only thing that's disposable, of course, are surgical gloves and then our masks, which we already had in stock. So we haven't faced any shortages on the PPE side. So we're old fashioned because it saves lots of money. Most clinics use disposable gowns and a whole lot of paper products, and that can really cost. Your disposables in your clinics, as you guys know, the disposable costs are very high. So by using cloth, which then we launder and of course sterilize, we've saved, you know, being able to have our clinics open. So that's how it has happened in the past month. And then the issues on why we kept doing our surgeries, that first I mentioned that our human side has not felt the strain of the influx of cases. And also we felt very, very strongly that our mission here is to train students. So you can watch videos of someone doing surgery all day, you can read about doing surgery all day, but until you're the actual one standing at the table doing the surgery, there's no other way to get experience in learning surgery. And we need to graduates that are ready to do spay neuter for their communities and service their communities. That's high demand. And so we teach, especially to our senior students, high quality, high volume spay neuter concepts, and they are exposed to those during their clinical year. So we had to finish our school year, and we are year round. We start again Monday. Our graduates finished Friday, and we start again Monday with the new class. So our mission is year round here. Also, our shelter partners, you know, needed us. Some of them are their sole source of spay neuter. We have several foster-based organizations that come to us, and we're their single source of getting their animals spayed and neutered. So we felt an obligation to keep them in business. So our continued plans are to follow the CDC guidelines and keep less than 10 people in the room, and obviously wear our PPE and keep our intake modified protocols in place. And Oklahoma is one of the states that have started lifting some of the restrictions on the staying at home orders. So we've had some of our restaurants start opening, some of our gyms. So again, we're fortunate that our state is a more rural state and less populated. So the impact of COVID has been less here in our state. So, but right now, as of right now, the plan in place is tentative to start back full with our students in place June 15th. And so once that happens, then our hospital will open back up. Right now, the hospital is emergency only. And like I said, we're the exception that in our shelter service, we have been able to continue to operate at half capacity. And as long as school, the whole undergraduate, the whole university starts back up in August, then in September, we will be able to have our first TNR clinic. The major impact that's going to be there is our April clinic is all our transitional clinic, where our outgoing student board members that are, we call them the captains, the captain stations and the coordinators are training. So as they graduate and move on, we bring in the younger classmen. So we haven't had that training opportunity. So it's going to probably be a lot of stress on me to get these people in place and get them trained with no transition period. So I think that's probably going to be the biggest impact on our community CAT program. And yes, I think we're going to take a little bit of hit on our population numbers because we're not, this peak kitten season, we're missing. So that we'll see how that's going to impact our shelter intake here in Stillwater, if that has, if we're going to see more kittens come in. And because we've been doing this since 2014, our TNR clinics, and we've really made a big impact on, we have one private Tiny Paws here in Stillwater that all they do is neonatal kittens. And for the past couple of years, they've expanded their acceptance area because Stillwater simply didn't have any kittens. So, I mean, we really have seen a big impact by having the Operation Catnip Stillwater. So we'll see how big of a hit we take come, I think, come fall and even coming around next spring. So that's our continued plans, and hopefully this all will settle back into life, and come June we'll be back full force again, and then come August when the whole university comes back online, off online I should say, and back to live students on campus. It has been a little bit of stress, I'll say a little bit on our staff, just because a lot of changes taking place a lot, and just communication, you know, okay, we're doing this, nope, tomorrow we're doing this. And so communication with the staff and keeping our processes ongoing has probably been the biggest challenge that we've faced. So yeah, I think I've taken about my time up too, so I'll pass it on to the next panelist.
Dr. Carter, thank you so much for your comments, and thank you for persevering throughout all of this and ensuring that you're getting as much safely done spaying and neutering done, you know, for the cats in your community. So thank you for that. If you're a colony cat caretaker, what issues worry you the most? Access to feeding and caring for colonies, access to food supplies to support the colonies, really stressed out about limited spay-neuter options, how to handle all the calls that for help that I'm gonna get, or put other in the questions box. All right, we'll close the poll, show the results. So pretty much everybody is still really, really stressed about limited or no spay-neuter. 38% are concerned about handling all the calls that I'm going to get, or are you getting those calls? And access to feeding and caring for colonies. So if you are having problems feeding and caring for colonies, we've discussed that earlier in the panels, and it seemed like everybody was having, you know, an okay time with access. If anyone is having a hard time getting that access to the colonies that they're taking care of, if you can expand in the questions box, that would be really, really helpful. And then my other question I have for the group, this is for folks working in a clinic or in a shelter environment. How do you feel? Do you feel safe and protected? Do you feel unsafe, or really not thinking about it? I'm really just too busy. Excellent, there you are. Are you unmuted? Did you unmute yourself? There you are.
I'm unmuted now, yes.
See, you just have all this control. I never have to do anything. No, you just know what you're doing. You're such a frequent flyer here. So Danielle Bays, many of you know her from HSUS. She's been a regular guest on the Community Cats podcast, and she's a huge, tremendous support to me. She introduces me to people all the time to be guests on the Community Cats podcast. So it's a huge thank you to her. If I did have a board of advisors, she would be on it. So, but that's one less job that she wants to have on her resume, I'm sure. So anyway, Danielle, feel free to share your thoughts with the group.
Excellent, thank you. Well, I want to first of all give a shout out to you, Stacy, for doing these. These have been very helpful and very enlightening in hearing from people from all over the country and different aspects of the community cat world. And I've gotten a lot out of them, so I really appreciate it. We've been very busy at the HSUS on a whole number of fronts, not just the community cats in this time, because we also have folks on the whole like wet market. Where did this all come from? phase of things. So it's been really fascinating, and just trying to provide a lot of resources to groups out there, to shelters especially. And when it comes to this whole spay neuter thing, it's been a big challenge. We have not taken any kind of position on whether spay neuters should stop or not stop. We don't have any clinics, so I guess on one hand we're kind of lucky that we don't have to dive into that and just refer back to the experts and the shelter vet community on that. But I'm always pushing for community cats and prioritizing that catch up, which I know is really important. It stresses me out too. When this all hit, I was in the midst of trapping at 2 different locations in my neighborhoods here, and so I am just afraid of how many additional cats. I keep going by there a little bit and looking around and see, but I haven't heard from the feeders over there if there are new kittens yet. So I'm hoping that I'm not going to have that personally as well. But with all these new protocols that we're all going to be having to go through when the clinics are ramping back up, how do we do all this with social distancing? I've been really thinking about how that can maybe help some of the community cats a little bit. You know, we want to limit our contact with other people, and one great way to do that for clinics is to kind of increase that cat to person ratio. So when you're thinking about all these calls, and that's, I think, feeds into this too, all these calls that people are getting are new cats, and we always want to try to help the greatest number of people. We want to, like, you know, give appointments out, first call, first serve kind of thing like that. We might want to rethink that. Is there a couple trappers that have a lot of cats? You know, maybe the first couple times we're running our clinic, it might make more sense to be able to get, say you're going to be able to do 50 cats. Can you get that with 2 or 3 trappers bringing those cats in versus, you know, 10, 15, 20 people that each have just a couple cats, because that's a lot more people that you're having to interact with. You know, you may, on day 1, you think your protocols are all set and how this is going to work and how people are going to sign in and how they're going to pay and all that. And you may find that it didn't work the way you thought, so you need to make some changes. So it could be a lot easier to do that when you're only having to deal with a couple people at a time. So I think that can also help in the overall population management. It's always a good idea to be able to get all the cats in one colony at one time or within a shorter period of time than kind of just do a couple cats here and there. Obviously, we know it doesn't take a lot of boys to get all the girls pregnant. So the more of the cats that you can get, the more impact we're going to have. So other policies, if you limit the number of cats per person, the number of community cats per person, if you limit the number of traps that people can borrow, you might want to think about that policy, and that might be a good time to change that and try to get that more cats, fewer people into the clinic the first time. The other thing I'm thinking about is when I go back out and trap too, like, how am I going to do things differently? How am I going to be more socially distant from people? And for a lot of us who do the cat trapping, we're pretty good at that anyhow. But we also want to include people in the community. We want to include the residents. We want to include the caretakers. We want to include the neighbors. We want people to all be on board and reach out to them. So how do we do that? We want to make sure that whoever we're working with, do we have phone numbers? Can we text them? Can we call them when we're out there? Instead of having to knock on the door and deal with them kind of face to face, what things we want to do. Do we want to pack an extra, case of hand sanitizer in our trapping kit? Are we going to go through that quicker? Those kind of things that we might want to think about. Or if you're working with people to trap on their own, how can you do that? Like kind of that remote mentoring. There are a lot of videos out there on how to set traps and how to catch cats, how to do the whole thing from getting them used to feeding on a schedule to getting the cats into the trap in the clinic. So is there a one that you like that you want to share with people, or maybe you want to make your own? For the people you work with. Now that we all have cameras that have video, it's pretty easy to do something. It doesn't have to be high tech. to be able to share that with people in mass, and then they can refer back to it, like, wait, how was I supposed to set that trap without you having to do it kind of like face to face. So I think if we start thinking about that, we start thinking about also like how many cats are out there that we need to kind of catch up on. When we're talking about like owned cats, owned animals, it's a lot easier for the clinics to kind of have a wait list. We know that this many people have appointments. For those of us who are doing community cats, we might know we have a couple sites, but we don't necessarily have a number. So another thing, kind of getting a better inventory of how many cats that are there, communicating with the clinic to kind of give them an idea of how many back surgeries that we need to catch up on, and kind of helping them figure out what those numbers are going to be too, as they kind of figure out the puzzle over the next couple months, however many months that might be, until we're kind of back to our new normal, whatever new normal is. We're still figuring that out. So those are kind of some of the things that I've been thinking about. I'm really interested to hear what other people might be thinking about, what other challenges or questions they might have. The shelter vets have recently come out with some new protocols. Kind of like a living document for clinics that are ramping back up and what to do. I think when I read over that, I had questions coming from a community cat trapper perspective that I was kind of wondering about. So I'm kind of interested in what other people still don't know yet, what kind of questions we have and what they might be looking for more help with on that front. So that's pretty much my thoughts for today.
So the other presenters, Dr. Carter and Jamie, you want to turn on your webcams for the Q&A section? I got an emailed question actually that I'll share with Danielle. Are there any specific resources that you had mentioned, resources around the clinic format, but are there any resources like best practices for trapping with regards to social distancing, or is there anything specific other than sort of the obvious that we should be thinking about? I know you were just talking about prioritizing, but is there a resource that's been put together focused on trappers? No, there isn't. And that was one of the things that I was thinking about when I read the shelter vet. I can't remember what. Do you have that in the handouts, the link to that document? Was that the one that's on the Best Friends link?
It's on the Best Friends site. Yeah. When I read that, that was a number of the questions that I have. So I'm trying to find out some answers for some of that. Like, we talk about limiting transmission and sanitizing, but how do we do that with the traps? Are clinics having concern about like trap covers?
Right.
Newspaper that you put in the traps, like how is that impacted? Are those areas of concern or not? So I think that may be the next important document that we can all work to put together. So I will help spearhead that with some other knowledgeable folks. I don't know all the answers. I'm not a veterinarian or epidemiologist or public health specialist, but happy to get the input of those folks to come up with something like that, because it does sound like it would be something very useful.
And as these clinics are ramping up and they have their new protocols and they have their tape on the floor as of this is your area that you can walk, and then you have to like magically pass the cat over, to the next person's area. A lot of these clinics are talking about doing community cat clinics first before they're dealing with foster homes and the public, and they feel like it's a more controlled environment. We never thought that feral cats would be considered controlled, but it's a more controlled environment, and you're dealing with 1 or 2 trappers bringing 15 cats in each, so you're dealing with 2 vehicles, and so it takes that whole public question out, and then they can just think about how they're working in the clinic, and their process is very focused on that. So if they are thinking about using then community cats first, then we actually kind of need to hustle and make sure we're presenting those cats in a way that the clinic staff would like to receive them. So I think that is something that we should all think about pretty actively if we want to try and open up our our clinics, you know, well, because we want to make sure this is successful on the other end, that's for sure.
Our high volume clinic is, we are going together with a couple other organizations to do a feral cat Saturday, Sunday type event where there's 4 organizations trapping over the weekend, and then those 1 or 2 people are bringing them in so that the clinic too can consolidate staffing and can serve PPE and all the things into kind of a 1-day event, just so that we can stay consistent with TNR efforts.
Dr. Carter, you had your hand up?
Yes, I think the main emphasis would be on your intake process, and like Jamie just mentioned, is limiting, first of all, any way to go paperless, you know, in advance is definitely the way to go. Even if the person is there, I mean, you can get very creative like that and just, okay, hold up your phone number, you know, and then you're standing on the other side of a door and calling someone and taking their information. So that's easy enough. The thing with traps is that unlike the carriers, you can't spray them down, because obviously, and to put a feral cat, you can't put a feral cat in a collet, so it has to be a trap. So that's where you would then limit the people that are in contact with anything that's coming in from the outside, and they would be, you know, gowned, gloved, mask or goggles. And that might be saying, okay, we're going to now induce in a separate area, and only 1 or 2 persons are in that induction area, and you maybe have to move that induction area somewhere else that can be more easily cleaned, or and not put that induction area in line with your other stations. I hope I'm making sense here. And then essentially, yeah, instead of, you know, that cat coming, the carrier or the trap and the newspaper, all that coming into your main flow, is you just hand the cat, an anesthetized cat, out of your restricted area. So I could see that being a very easily implemented policy. And thankfully, you know, this virus is very easy to kill in the environment. It's not persistent. It is not like panleukopenia. It is not like parvo. It's very easily disinfected. So, you know, you have the person taking the cat out and 1 person cleaning those traps and relining them, and you're good to go, you know. And so I think it's very easily implementable process.
I have a question going back to Jamie, to your fundraiser. How did the fundraiser for your slumber party work? Did you sponsors for how many hours a volunteer would stay at the shelter, or, you know, how did that actual fundraising process work?
So it's a very, there's a lot of moving parts to it. So I would suggest, if anybody wants information on that too, to shoot me an email, which I think is shared, or you will be sharing. And I have hopes of kind of having a larger kind of national event potentially next year as well, so that all of us can do this together and get some really great exposure out of it. But it's a peer-to-peer campaign, so we chose specific people to be in the kennels with the animals, because 1, you have to make sure that they're comfortable with being in a cage for, you know, a kennel for 24 hours. But also you want to make sure that they're the right people with a large enough network to help you raise money as well. So.
Great. And then we have here, so another question for Jamie. What kind of social distancing are you using, a group planning to use at your facility, and are there any resources you're relying on with your future planning?
So we are still getting to that, and I guess our clinic is kind of in 2 parts. We want to start spay neuter first, because we feel like that's less contact. And again, we're talking about TNR, which obviously we can decrease the number of people in the space, and then the foster animals, which we're doing, or adopted, which we're doing curbside foster appointments anyway, so we're using that curbside method right now. As far as our public clinic is concerned and opening that up, I don't know yet. We're still brainstorming how we want to utilize that clinic. That was going to be a profit stream, a small profit stream for us, our income stream. And so we're thinking about kind of rethinking the whole thing. Maybe it's not so much about the wellness and vaccines, heartworm preventative, combo test type thing, but maybe it's more minor medical care because that's what's necessary right now. So we're trying to, we may be potentially repurposing it, but I'm not sure. But we're going to be following and looking at any of the national guidelines that we can, whether it's, National Animal Control, NACA, or American Pets Alive has some really great information that they're putting out there. You guys, as far as clinic procedures, American, the AVMA, anybody that we can look at to kind of gather all the resources on how to do this as safely as possible, and then we'll put our plan together from there.
Got it. All right, so I do have a request for the panelists to share their emails. I don't know if you want to do that, or if you'd like to email me about whether or not you'd like to do that, and I can email the group. It's up to you.
I'm fine with that.
Fine.
Sure.
Okay, all right. So I will email the registrants your email address so that they can follow up with you. And also there's an announcement here from Julie Jacobson saying that they have an immediate opening for a associate spay neuter vet in Cookeville, Tennessee. So Dr. Carter, if you have any suggestions, please keep Tennessee in mind. One other thought is to ask trappers to remove all paper, et cetera, from traps before bringing them into the clinic. So that is another, just a thought, an idea. And I have a question for Danielle.
Oh, no.
You're talking about, you talk about, checking in on your colonies and seeing how things are going. What is better? Is it better to know or to not know in this world? I mean, if you can't immediately do something, and say you go and you check in a colony and there's a situation, injured mother or whatever. I mean, it's so hard. I've run into so many situations where people have trapped cats that probably in our definitions of trapping shouldn't have been trapped. They should have been left outside to have their kittens outside, but they've had complications, with their kittens or pyometria or whatever. They've had various different complications. One story with a cat that had at least documented 6 litters or something before. And anyway, so is it better for us to know now what the list looks like, or is that just too much anxiety for us?
I really think it depends on the individual person, whether that is going to give you anxiety or not. I find myself, wherever I'm around town, I'll be driving by somewhere, riding my bike. I was just riding my bike yesterday and thinking, oh, I trapped some cats in that alley probably 6 years ago. Let me just, veer down there to see what's going on. Like, I'm always like going by, like, there are people who are caring for them. I just, was trapping, but I'm always kind of going by and, do I remember that cat? I'll see a cat and, just out of my curiosity, I like to do that. But other people, it may be too much. I'm also always thinking about like data and how many cats are there, how many cats have we sterilized there, and how many are still left, and if there are too many still left, how many is that colony going to increase? So for me, I like to know that. If you are in a situation where if you came across a cat, like right now, given the circumstances that we're all living in, that was injured, and you live somewhere where you couldn't, there's no options. Yeah, I might be more hesitant. We still have enough emergency veterinary work that's happening that I think we could deal, but I think that kind of, whether it gives you anxiety or not, is really an individual thing, and it helps to just know yourself, and also to realize that we didn't create this. Like, and it's one of my big pet peeves with like a lot of people who write about community cats and don't know anything about them. They talk about how we create these colonies. Well, we did not create these colonies, right? We're out there trying to help them. We're trying to help reduce the number. So it's not our fault if we can't fix everything right now. We shouldn't blame ourselves or shoulder all of that burden. We're doing the best we can given the situation that we didn't create. So no, you're doing as best you can, and that's if that's all you can do. If the best you can do today is this, that's okay. You know, we have to kind of forgive ourselves and kind of let it go sometimes. But I think it really helps to know yourself.
There's going to be no veterinarian that is not going to offer an emergency service, you know. So I don't think if you had a true emergency, you could not find somewhere.
Right. The hard part is the knowing that there's an emergency out there. You know, if you're, you know, if you're not out there trapping, you're not going to know there's a pyometria cat out there. You know, that I think that's sort of the biggest issue is that if there's a pregnant cat out there. I mean, there are a lot of people trapping now that have pregnant cats in their houses and they're having kittens that way because that's their peace of mind. So our trappers are becoming a different kind of foster home than they may have in the past. So, and they're doing it because that's what makes them able to sleep at night is that they then feel like they know when they're doing and they have some control, even though they don't know when they're going to get the kittens, you know, spayed and neutered, when they're going to be able to return mom, but they're loading themselves up with, you know, with these situations. And as this keeps going on, they may have more. Now, it sounds like things are opening up, and I'm glad the community cats are first in line because that's going to get those trappers back into that normal behavior. So I think that that's all good news. So hopefully this is really a short-term thing and things are going to open up and people are going to start turning back and being able to get the cats spayed and neutered, maybe not at the volume, but at least enough to keep the load off there, because they don't have access to 350 foster homes. You know, the trappers don't. When they're on their own and they're doing it by themselves, they don't have that kind of support network out there. So that's where I sort of see a bottleneck happening of right there, where there are potential cats and kittens out there that could use foster assistance, but they're not able to funnel through the system in that way to get to those foster homes.
That's a good.
Oh, thanks, Jamie. I don't want to, DC cat count. What's going to happen with that?
Oh, DC cat count. Yeah, so we're still plugging along, and that, for just to kind of give a brief summary, that is a project that we're working on here in DC with the Humane Rescue Alliance, ASPCA, Maddie's Fund, PetSmart Charities, Smithsonian, a bunch of folks to kind of get a whole population of all the cats in DC, that one's outside in the shelter and in homes. And from that, develop some tools that other communities can use to assess their populations as well. So we are changing a few things up. We were recently deployed our household surveys, and the part of that was to go follow up door to door with people who hadn't responded. So that's not happening. We will be following up on in another fashion, but that's still a go ahead. Our field work, where we have wildlife cameras deployed throughout the district and in targeted areas, we're paused on that right now. It's kind of delayed for a number of COVID-related reasons, but that is not going to delay the project overall. We're still on target for completing our research and having some results from that, which would be next summer. We have so many images of cats across so much data already that we're kind of ready to be able to go and do the kind of analysis and look at the kind of dynamics of how the different populations interact, and then can add that data in later. So yeah, it's not stopping us.
Excellent. Dr. Carter, I have a question for you about supplies and drugs. So the the drugs that you use and the supplies you mentioned, how you reuse and recycle as much as you can, but your various drug cocktails that you use and that kind of thing, are you using any human drugs, or are you like animal only specific?
Well, we're flexible. So we have gone through 3 different NSAIDs. So we have changed 3 different times between robocoxib, meloxicam, and carprofen. So that seems to be our biggest change, that we just go with what we get. And then same thing on our opioid protocols. We have been switching back and forth to hydromorphone and morphine, back and forth, and it's just on availability. So, you know, if they say we keep ourselves in the queue, and just, we have not had any shortages. Now we have had to change, but we haven't had any shortages. And yes, we do tend to stick with the veterinary products, so especially the teledamine, so that has not been an issue. So we do use TT-Dex protocol, which is, I'm going to use some trade names here, so sorry, teledamine, torbagesic, and dexmedetomidine. So that is our standard protocol, and we haven't had any issues getting those drugs because they are veterinary specific. So
Good to know. Good to know. Well, that's a good news, hopefully, for the clinics that are trying to get themselves ramped back up. I mean, I know they've probably got some stock that they can work through, but I know that's been a concern about getting access to supplies and necessary drugs. But it sounds like you have to be flexible and be able to work with some different combinations too. And I think flexibility is critically important. And it's a challenge for the MASH style clinics, because I think we are very programmed into a certain process. And I think we, you know, especially when you work with a lot of different volunteers, I totally feel your concerns, Dr. Carter, when you're talking about retraining your station captains and that kind of thing, or teaching new station captains. So I can see that being really challenging. With each monthly clinic, we have monthly clinics that at Merrimack River Feline Rescue Society, and each monthly clinic, I can see protocols changing from one month to the next, and that's going to drive people bonkers. But they're going to have to learn how to be flexible too. So, any last thoughts from the panelists today? Nope.
Thank you.
I'll just say it's really exciting to hear how we're being very adaptive and coming up with new ways and really supporting each other through this. So I'm really excited feeling reinvigorated today after this call.
Jamie?
Our world got really small as far as animal welfare is concerned, and it's neat to be, you know, connecting with so many people across the country doing such great work that, you know, we can learn from each other and you know, draw that from each other.
Excellent.
I think a lesson learned here is regional and not one size fits all, and it's okay to adapt to your region. You know, when you start putting out blanket statements for a whole process or a whole branch of medicine, you kind of take too big of a chunk. So I think that everybody knows their communities and knows their region well enough that they're boots on the ground, that they can adapt to their own situations without a whole lot of overreachingness, you know, from other or outside influences. I think, you know, our main goal is animal welfare at the basis of the heart of everything. So I think we can achieve that goal and still maintain a balance with human medicine.
Excellent. All right. Well, thank you so much. Thank you all for joining us today. And just a reminder, if you want to go to the communitycatspodcast.com and register for our 4 o'clock pop-up panel on Monday, May 4th, feel free to join us. And I'm really looking forward to it. And thank you all so much for all that you do for Community Cats. And we'll see you next time. Bye.
Bye.